Welcome to Nursing Made Easy. So today I came with a topic, abnormal lung sounds. So if we are doing an auscultation as a nurses, if we could identify the abnormal lung sound, that's very beneficial in our clinical side. Isn't it right? So in this video, I'll just show you so you can listen what is the abnormal sound, that particular sound. So once you are familiarized with that sound, it would be easier for you if you experience it or if you are hearing this sound when you are doing the auscultation next time. So this video would be helpful in your clinical side. Also, if you are preparing for your NCLEX RN test, that would be beneficial for you too. So we can start the video. So first I'm showing the normal lung sound. Just listen to this. This is a normal lung sound. Normal lung sound I'm showing is coarse crackle sound. So that sound will be just like when we are shoveling a big rock. What would be the sound? So that sound will be somewhat similar to that kind of voice. So you just listen to this. Abnormal sound is fine crackles. So that sound is somewhat similar like we are slurping water, like those kind of sound. So just listen to the fine crackle sound now. The next sound is a wheezing sound. That would be most familiar for us. It's just like a musical horn, those kind of voice. So just listen to the wheezing sound now. That's an expiratory wheezing. Next abnormal sound is pleural friction rub sound. So that would be like when we are walking in a creaky wooden floor. How would be the sound? That sound will be somewhat similar to that. Just listen to that. Abnormal sound is raunchy. We can pronounce in that way. I'll say raunchy. So that would be somewhat similar to snoring sound. Just listen to this. Last sound is a strider sound. That sound will be somewhat similar to a sea lion. Seal is barking. Those kind of voice will be coming for this sound. Just listen to that. These all are the abnormal lung sound. I hope you got an idea which all are the different abnormal sound. So the next video, I would explain each sound, what is the problem. So if you hear a particular sound, what we can suspect. That's my next video. So see you for the next video. Bye-bye. Take care.